So, lunchtime lifts. Have you ever heard of that? Lunchtime facelifts. I mean, let me tell you, some people don't even have time to go to lunch, but for a facelift, they'll go to lunch. But you're not going to get lunch, you're going to get a good facelift. And now that I've said that to you, I know you're going to be very excited about hearing from Tim Reed, who is the partner with an organization. It's called the Forever Trim Body Sculpting and Plastic Surgery Centers of South Florida. And they have locations all over. So we're going to be very excited to hear about this. Well, Tim, it's wonderful to have you back. And I know that you and I have done a lot of things when people lost their hair. You helped get their hair back. And now you're into things that are very important. Everyone talks about having facelifts, but, you know, it's not only very expensive, it hurts. So what have you come up with?
Well, great to be back, Anita. We did have quite a run with the hair therapy, and we still do the hair therapy. But as we've investigated more non-invasive treatments, I've partnered with a physician. So we have an organization now that does both non-invasive procedures as well as surgical procedures. Obviously, many people can't do surgery due to health reasons, or maybe they just don't want to. But our featured product is what we call the lunchtime facelift, and this is done in the office in about 1 to 2 hours using ultrasound. There's no incisions, there's no downtime, and there's no surgery.
Well, something I know about Tim, he has always been in the medical business. He has cared a lot about it when other people weren't doing things, but he always cared enough to do research and make sure that what he was doing was really right on. And I don't have to tell a lot of our listeners that there have been a lot of advertisements, which really, when you go and find out what it's all about, they're really not responsible or reliable. So we're happy to have Tim Reed on our show today talking about the Forever Trim Body Sculpting and Plastic Surgery. Well, you know, when you talk about ultrasound, the only thing I know, now ultrasound is coming very big, especially for people who have mammographies and they can't tell what they're seeing. Next thing you know is ultrasound. Or if you're having a baby, they can tell what the sex of the baby is with ultrasound. Yes. You know so much about this, so why don't you tell us a little bit about, put your medical hat on, please, and tell us about ultrasound.
Okay. Well, first, I did a lot of investigation before we purchased this product, which was about 1.5 years ago. And all the products that we do that are non-invasive have gone through full FDA clearance. So these are not experimental type of products. These are products that are proven in the marketplace. Ultrasound, it's very similar to, yes, doing an ultrasound on the baby, but it's used in a little bit different manner. And this device, which is called Ulthera, is the only company that has the ability to lift skin. This is what their FDA clearance is to lift skin on the neck, face, and eyebrows. And how they do it is the device, ultrasound, is treating the deepest level of the skin versus treating the skin from the outside in. It's treating it from the inside out. So while the technician is doing the treatment, they actually have an ultrasound screen in front of them so they can see exactly where they're treating the person that's getting the lift. So what happens is it's called focused ultrasound. So it creates heat at the layer of the face that is normally treated during surgery, the muscular layer. What that induces is development of new collagen and elastin, which basically, these are the two key ingredients that hold your skin and your face up.
And of course, those words always come up when people are selling their products, whether it's, you know, the fanciest products when you go to Macy's and you go to Saks, and that's what they always talk about. Use this product and you're going to get more collagen and all. And, you know, I think there's even supplements you take for collagen. So you're saying that this is a very sure way and a fast way and to actually lift your skin from the inside out.
That's correct. So it's a super unique technology. The manufacturer obviously has a jump on the rest of the industry, so to speak, because typically when people are selling you things to induce collagen, they're selling you, when you come into a spa like ours, it's a treatment that is from the outside in, and it creates heat. But with the heat, you can only get so much heat on the outside of the skin without burning the face or the body. So with Ulthera, it's able to treat all the way down to the muscle, where any other device that would be claimed to produce collagen is only going to be able to treat about a millimeter down. The Ulthera device is treating at 4.5 millimeters.
This is very exciting, Tim. So when you walk out, is your face red?
You will feel a little bit of redness. There's no pain on the surface of the face. In other words, since we are treating all the way down, it's on the inside, you feel nothing on the outside of the face. When I did my treatment, when we first did it, I got back up, and I went back to work.
Okay, but it could be pretty. Yes, you had little rosy cheeks, right? But
there's a little bit of redness, certainly. But the outside of the face, when you're treating, there's a gel on there, so it's smooth, and it's not. It's a nice smooth when they apply the applicator over those areas.
Right, because when you have an ultrasound, they always put the gel on the area where they're doing that. But I guess my other question about this is, are you? So do you notice with one treatment? Are you noticing something, or how many treatments do you really
actually,
need?
this is a one treatment type of procedure. Okay, so it creates enough of a injury or trauma to the lower level of your muscle that the collagen will produce, and this grows in basically results.
So exponentially,
exponentially, it'll be all the way out to 6 months. You'll continue to see a change. We see the largest amount of change between month 3 and month 4. Okay, the reason behind that, when you're truly producing collagen, it takes the body 6 to 8 to 12 weeks to actually produce that. So this doesn't happen overnight. This is a normal progression, and that's why when you walk out, you'll feel a little bit different firmness. But again, since we're working from the inside out, we have to wait for the natural process of the collagen and elastin to rebuild itself.
So is this going to kill the plastic surgery business?
Well, no, actually, it's funny that you asked that, because Dr. Rodriguez has done more than 2,000 facial procedures. And he has developed a very minimally invasive surgical procedure. But there are people that, again, really aren't ready for it. The Ulthera could be used as a preventative measure. So if you're in your 30s and 40s and you're starting to see your jowls drop, you can do it to prevent that from happening, okay, before you get to the point where you might need a surgery. And there's individuals that come in and they're beyond the use of this device, of course, and we do this minimally invasive lift, which is a lower lift for the neck, and it can be done in about an hour. It has very few incisions, and he trained out in Beverly Hills and developed a unique what we might call a mini neck lift that is super, super popular.
Wow. I am so glad you came on our show today, Tim. Tim Reed is the partner in the company called Forever Trim Body Sculpting and Plastic Surgery Centers of South Florida. They have 4 locations: Plantation, Boca Raton, Miami Beach, and Naples. And if you want to call them for more information, just get your pencils out. Remember, this is Pencil Talk Radio. The phone number is 1-844 Ulthera, Ulthera, or I'll give you the number. It's 1-844-858-4372. That's 858-4372. You can go online, though, and you'll be able to see a lot of these, a lot of the results. I was very fascinated about that. And so your website is, I guess, it's for beforevertrimsouthflorida.com. beforevertrimsouthflorida.com. And you'll see a lot on there. So Dr. Michael Rodriguez, and you are going to make women and men, we should talk about that, women and men beautiful. Are you finding that men are coming in?
I would say about 30% of the customers are men. It's very appropriate for a man to have it done, and probably more likely that a man would go to do a non-invasive procedure versus an invasive or surgical procedure. So yes, I got a great result. Very happy with it. In fact, my before and afters are on our website, because I typically will try every device that we have. I have to put hands on. I'm somewhat of a advocate for solutions that work as long as people are realistic in what these type of devices can do. So we are very selective, and Dr. Rodriguez is a big advocate for the machine. You wouldn't think so because he's a surgeon, but there's a fit for different machines and non-invasively, possibly before you do surgery. We recently purchased a machine called the Cool Sculpting device, which would be a replacement type procedure, non-invasive, rather than doing liposuction surgery. Again, it's an FDA approved device. It's gained super, super high popularity now. It's been on all the talk shows, Dr. Oz, but basically when you do a liposuction surgery, the key to it is that the surgeon is able to extract fat from the body. Okay? No other procedure except for this Cool Sculpting produces that kind of a result. Any other procedure that we do to do body contouring is shrinking the cells, okay? Which is going to change the dimensions of the body. You're going to see a change in sculpting. We do a lot of Zerona, which is a non-invasive type of device, which shrinks the cells. But you have to be careful because those cells are still there. And if you're not changing your lifestyle, you end up on that same roller coaster, lose weight, gain weight, lose weight, gain weight, okay? With the Cool Sculpting, the cells, the fat cells themselves, healthy cells are not affected, are frozen, and they actually crystallize. So in the area that we're treating, 25% of the fat cells are going to die, crystallize, and go away, eliminated naturally through the body. It's not obviously doing any incisions or whatever, but that is what the FDA and all the clinical studies had measured. And it's pretty amazing, actually, because it's a 1 hour treatment and it's a one-time treatment.
Yeah, I asked him about this when we were talking before the show, and then I said, well, what happens? And he said, of course, your body just eliminates it. But I was thinking about that. So you said something. How does it know? Does it know what fat cells to freeze by where you place the laser?
Yeah, basically, this is
laser,
this is not a laser.
Not laser. So
this is freezing.
This is freezing.
Okay?
How do you do that?
So basically, it has a
ice cubes.
Kind of. It's kind of like a cup, okay? And the cups are designed to fit around, say, your flanks, okay?
Yep.
The front of the body. It goes all the way across the front, and they're shaped so that we can squeeze the fat and pull, and it vacuums the fat into the cup.
No kidding.
There's a cooling plate on each side, and the cooling plate literally freezes that section of that we're treating. And what they've found is that, again, healthy cells are not affected. This freezing effect will only attack fat cells. So any cells, the normal cells that are in there, are not going to be. So it's very natural. And then what happens, apoptosis is basically cell death. The cells will die, and the body just eliminates it again. It takes 4 to 8 weeks for the body to get it out, but you'll slowly just shrink down.
The more you talk about this, the more it's almost like I had to go there. It's like a museum almost of all the latest and most important things for people to look good. I mean, we all stand in front of the mirror and take the fat and pinch it. So you're saying that you take that fat, and then those are the cells, because it wouldn't be fat if you couldn't, right?
That's correct.
Cells that are not. You don't look like you have a bit of fat on you, and you must be exercising a lot. You look so good, but you're saying that anybody has any extra fat, that's what can be eliminated.
Yeah, the key is what we refer to as subcutaneous fat. Subcutaneous fat is the fat that is, the muffin tops, the stuff that is obviously outside the muscle, okay, where we can pinch it. Simply, if you can pinch it, you can get rid of it, okay? Because we all have two types of fat. There's fat that's behind the skeletal muscle, which is called visceral fat, and that's the fat that is around your organs. And then we have the stuff that we can pinch and touch. And that's the fat that we get. Liposuction is able to get the fat. The only way to get rid of your internal fat or your visceral fat is through diet. But most people can pinch quite a bit. When they say pinch an inch, that's an understatement for most people, and even fit people. This is not something that is limited to people that are well overweight or obese. They can come in too. We get trainers in that, again, there's stubborn fat that lays around your belly that is basically the body does not want to release. And you could work out 7 days a week, running, doing whatever, and you can still, a lot of people can still pinch. They just can't get rid of it. So it could be a minimal amount, or the average person really can pinch more than an inch.
Pinch more than an inch. That's good. So if someone is eating properly, though, will that fat ever disappear?
No.
That's very important.
Typically
so people
not.
on diets and people who are they really can't get rid of that extra fat.
Right. It's the body is genetically predisposed to store that fat there. Okay, the subcutaneous fat. It's white fat cells, which is different than your internal fat, which is brown. Brown fat burns quicker. The subcutaneous fat is stored there in the event of starvation. So that's why the body doesn't want to get rid of it. If something happens and you're unable to eat, it uses that as a backup source of energy once it's already been through any of the other body fat that it can use. So that's why they refer to it as stubborn fat. You can work out, diet, exercise, and you can get a lot of it off, obviously, through diet and exercise. But ultimately, unless you're a super athlete and have 5% body fat and extreme, and these 6 or 8 packs you see on these guys, the average person can't train that amount. They can't go to those lengths. And so we all have the stubborn fat. I think everybody has it except extreme athletes.
So that's a very good point now, Tim. So it's a matter of people who could be very overweight, or people who could be not overweight in our eyes, but they see there's 1 inch to pinch or something. So we went through quite a few things. Let's kind of go over that again. The one thing we talked about was the lunchtime facelift.
Correct.
And that's something that you use you use the ultrasound
correct
to do.
Right.
And then you talked also about Ulthera. Now,
Ulthera is the lunchtime facelift.
So that's what we'll call Ulthera.
That's correct.
All right. Then you also talked about Zerona.
Okay.
Is Zerona still?
Zerona is still an option for individuals who want to lose subcutaneous fat. What it does is it's low-level laser, penetrates the skin. It causes a hole in your fat cell to appear, and the fat leaks out. So it's kind of like squishing grapes, right? But those grapes are all squished up, and the body will eliminate the fat that has leaked out, and you'll shrink. But the cells are still there. So the next step up would be the freezing, cool sculpting, where the cells will crystallize and actually leave the body. And this is the only device that can that is FDA approved to do this, and it basically produces a similar result to liposuction where liposuction, which is surgery, they're going to go in and actually vacuum out those fat
I have
cells.
seen that surgery. As a matter of fact, it's not something that I would look forward to, but I saw it being done in a plastic surgeon. So when you say that it can be done this other way by freezing the fat cells, it's very appealing,
Yes.
Tim. Very
Yes.
appealing. For people who are interested in this, it's Forever Trim Body Sculpting and Plastic Surgery Centers of South Florida. They have 4 locations: Plantation, Boca Raton, Miami Beach, and Naples. The website is beforevertrimsouthflorida.com, or you can go to their phone number, which is 1-844-ULTHERA, ULTHERA, or the numbers are 858-4372, and I'll repeat that again, 1-844-858-4372. And I asked him before, and if you come there, he'll show you pictures of before and afters.
Yes,
So-
we have, with the Ulthera device, we are actually awarded as the #1 provider of this service in the country. So within our
Amazing.
4 locations, we have treated over 1,200 patients doing this procedure. And so we have extensive experience. We have our own set of before and afters. We don't rely on the manufacturers because we've developed so many good before and afters from our own patients that we treat.
All right, and so who actually does this? Is it Dr. Rodriguez, or you have assistants that do this?
No. The doctor does not do this procedure, and I wouldn't expect normally for a doctor to do this kind of a procedure because it's a very protocol type of procedure where the manufacturer has laid out basically we put a grid on the face and we take the device and we move it through those grids, okay? And there's a certain amount of treatment you do within each grid. So it's something that
A technician,
is very,
a trained
very
technician can
trained,
do
right?
this.
Our girls are all laser certified. They could do much more invasive types of procedures, but we do have them. They're all CMEs, laser certified, and the ultrasound being so safe, it's really just having somebody with the background of the clinical background of skin and face, because of course they start as estheticians, then they become medical estheticians, then they become CMEs, and they become laser certified. So our girls are right at the top of the ring.
And this is, and at every center that they go, where is Dr. Rodriguez? He's the one in Plantation?
Yes,
Or
Plantation is our main location, and that's where we do some surgeries and also the cool sculpting and a variety of other facial procedures like laser CO2, which is a refreshing type of treatment for the face. We do...
Tell me what that is.
Basically, that's a technology that, again, this is working from the outside in, okay? And think of it as almost like a laser peel, but it's much stronger than even the strongest medical peel that you can get. It's the latest technology in kind of like resurfacing of the face. It's not going to lift skin, but it's going to resurface the face.
Get rid of all your brown spots and all your other
brown spots.
and
Also,
things.
it will significantly reduce wrinkling as well, and very, very significant change in the texture of your skin, because it is an aggressive treatment. It uses laser, and it takes about 3 or 4 days before you could go out into the sun, or because of the actual treatment itself.
Okay, so you have something else. But I think what appealed to me and probably to our listeners is the fact that you're going from the inside out.
Yes.
And that's what you've been talking
That
about.
is the unique thing with the Ulthera. So the company has done in excess of 300,000 patients, not us, but the Ulthera device. And throughout all those treatments over 3 years, there's never been one single permanent adverse effect. So the nice thing about it is it's very safe. And they're expanding also, in addition to the face lift, they're also just now getting an FDA approval in the process of doing it for the décolleté too. So it's a very similar process, but if your décolleté, a lot of times when you sleep on your side,
You've got wrinkles.
And of course, yes,
yeah, a lot
sun
of wrinkles.
damage.
Oh yeah,
and in the décolleté, so we'll soon be able to treat the décolleté, and it'll basically wipes out those wrinkles.
No kidding.
It's amazing.
Now that is amazing.
Yes,
because that's a place that's a little dangerous. You have to be very careful there. But this is really. I am so glad that you came here today. This is like an answer to all of our prayers that we haven't really heard about. And,
well, we're trying. We're trying to focus on a combination of offering both non-invasive, as the leading edge non-invasive devices, as well as for people that do choose to have surgery. We're doing that as well because we do all the body types of surgery for breast augmentation, tummy tucks, of course a lot of facial procedures, and so we really have kind of an A to Z type of solution for people.
It's almost like a spa.
Yes, we're definitely a very, very much a medical medi-spa.
And so when someone comes in, who sits with them, and it's a consultation to see what is it that I want, what is it that's going to work? Is it you? You can't be everywhere.
No, we have consultants that have, both of them have been with me for over 5 years. So they've been doing consultations for a variety of different cosmetic things. And we're trained by the manufacturers on any new products. And they're very astute as to, okay, well, this individual, you're really past the point of Ulthera. You really need, it'd really either do this, maybe a laser, if you don't want to do surgery, or something else that would be a better effect for that particular individual.
And so I see, because if they do the one thing, they're not going to get the results that they're looking for, and it may not be a waste of time, but it may not be as important as what you were saying, right?
Any non-invasive device is not for everybody.
Well, with that, we hope we'll have Tim back again. This is exciting stuff. I'm so happy that Tim Reed came here. And remember, go to their site on the web, beforevertrimsouthflorida.com. Everybody wants that. Thank you, Tim.
Okay, Anita, great to see you again.
Yeah, it was
Thank
good
you.
to see you, too.
All right, bye-bye.